Orrin Hatch was the American dream personified. The scrappy son of a Pittsburgh metal lather, Orrin grew up during the Great Depression. Yet he overcame the poverty of his youth by working blue-collar jobs to put himself through college and law school. An accomplished boxer, Orrin brought that same fighting spirit with him to the courtroom and later to Congress. As a U.S. Senator, Orrin fought passionately for his principles, but he also had a penchant for bipartisanship. When the man known as the Gentleman of the Senate retired, he had passed more bills into law than anyone alive. Civility and solutions were his hallmarks, and they are the principles that guide our mission today. The Orrin G. Hatch Foundation seeks to build on Orrin's legacy of effective policymaking. Through our numerous publications, we tackle today's political challenges with ideas that transcend partisan lines. Our work has been highlighted time and again by national media, including the Wall Street Journal, USA Today, Newsweek, and many others. The foundation is also home to the Orrin G. Hatch Papers, one of the largest collections of congressional history ever compiled. Making this library accessible to students is a key part of our mission to inspire the next generation of public leaders. To that end, we have helped establish student housing at the Orrin G. Hatch Center in Washington, D.C. But what truly sets us apart is our convening power. Hatch alumni comprise one of the most expansive professional networks in the country, and we leverage that network to provide a platform to industry and individuals alike. We bring together disparate voices from the public and private sectors to tell their stories and to find common ground. Whether it's through our publications, papers collections, or symposia, our goal is the same: to restore America's institutions to their proper place and function. This is how we're building on Orrin's legacy. And it's how we're securing a strong America for the next generation. Join us.
Thank you for joining us today on this webinar. My name is Matt Sangren, and I serve as the Executive Director of the Orrin G. Hatch Foundation. I look forward to our conversation today about the legacy and future of the Dietary Supplement Health and Education Act, better known as DSHEA. This law, which fundamentally shaped the regulatory framework for dietary supplements, was championed by Senator Orrin G. Hatch, who fought for consumers' rights to access dietary supplements and for measures to ensure industry safety and transparency. DSHEA struck a balance between access and oversight, between innovation and accountability. And yet, over 3 decades after the law's passage, questions remain. Is the balance that DSHEA struck over 30 years ago still working? And how can policymakers, industry leaders, and consumer advocates work together to protect both access and safety? With this as a backdrop, I'd like to introduce our panelists. Each of them brings a unique perspective from law, government, and industry. Kyle Sampson is a partner at King and Spalding in Washington, D.C. He focuses his practice on FDA compliance and regulatory enforcement matters for companies in the food, drug, biologics, medical device, cosmetics, and dietary supplement industries. He's also a former Hatch staffer, having worked for the senator on the Senate Judiciary Committee. Welcome, Kyle.
Thanks, Matt.
Steve Mister is president and CEO of the Council for Responsible Nutrition, or CRN. Under Steve's leadership, CRN has led the way in advocating for the dietary supplement industry at the international, federal, and state levels. Welcome, Steve.
Thanks, Matt.
And finally, Scott Bass is the founder of Sidley Austin's Global Life Sciences and Food and Drug Law practices in the United States, China, and Europe. Among his many notable accomplishments, Scott worked under Senator Hatch as a lead drafter of DSHEA. As the saying goes, he was in the room where it happened, and we're grateful that Scott's joining us here. Welcome, Scott.
Thank you very much.
Well, I know all of you are extremely busy in your own right, and we are just grateful you'd spend some time with us this day. As we talk about DSHEA, it's long overdue. We at the Hatch Foundation have been wanting to do this for a while, so I'm grateful that we're doing this. But I want to lead right into it. Why should our folks who are watching this webinar care? Why are we focused on DSHEA now? And I want to begin with Kyle. I want you, Kyle. I know you've got a robust practice in this area, and I want to talk a little more about. I want to talk about drug preclusion, the drug preclusion clause that's currently applied. You know, I want to know if it's being applied in a way that aligns with DSHEA's original legislative intent, and if you could give us a little more of a higher level of what's happening at the moment at the FDA on this issue.
Sure. Thank you, Matt. So I do believe that the drug preclusion clause is currently being applied in a manner that's consistent with the original intent when DSHEA was enacted, but I have concerns. So under the Food, Drug, and Cosmetic Act, that statute of which DSHEA is a part establishes distinct categories of products that are regulated by the FDA. So there are food and dietary supplements and drugs and biologics and medical devices, cosmetics, tobacco. Each is defined under the Food, Drug, and Cosmetic Act and placed in a specific category and then regulated differently by the FDA. That's what the Food, Drug, and Cosmetic Act does. The definition of dietary supplement is really, it's very specific. It's a product that's intended to supplement the diet, contains a dietary ingredient, has to be swallowed, is not represented for use as a conventional food. It's labeled as a dietary supplement. And importantly, the definition of dietary supplement includes a provision that says it's not a dietary supplement if it includes a pharmaceutical ingredient. More specifically, under the statute, an article an article has been investigated as a new drug. Well, let me say this. A dietary supplement cannot contain a pharmaceutical ingredient. That is, it cannot contain an article that's been approved as a drug or that's been studied as a drug. That is, that's been authorized for investigation as a new drug, for which substantial clinical investigations have been instituted, and the existence of those clinical investigations is known. That's the drug preclusion clause that you asked about. So for purposes of our discussion here today, it is the drug preclusion clause says if you have a pharmaceutical ingredient in your dietary supplement, it's not a dietary supplement. It's excluded from that definition. There are a couple of exceptions to that. It can still be a dietary supplement if it was marketed as a dietary supplement or as a food before it was approved as a drug or before it was authorized for investigation as a drug, or if FDA issues a regulation and says it's okay. This ingredient can be marketed as a dietary supplement. The
Let,
purpose.
let me ask you, let me just pause on that. When you bring, is this the first to market principle that you just touched upon? What explain a little more about that too, I didn't mean to break in, but I want to make sure that we're getting some of these definitions out there. So you've talked about the preclusion clause or the drug preclusion clause, but what is this first to market issue that we should care about?
Well, the first to market principle is if you're first investigated as a drug, you can't later be marketed as a dietary supplement. If you're first marketed as a dietary supplement, you can be marketed as a dietary supplement even if later investigated as a potential drug. And so the purpose of that principle in the statute is DSHEA established the pathway for dietary supplements. It established that market that now is $60+ billion market. And so that was part of Senator Hatch's handiwork in working on, and Scott Bass and others' handiwork in establishing DSHEA. But the purpose was to allow innovative dietary supplements to market. These are products that are intended, to help consumers with their health, to maintain their health. At the same time, preserving and maintaining the incentives for drug companies to invest in the research and development and science associated with ingredients, whether they might be able to be shown to be safe and effective for the treatment or diagnosis or prevention of disease, including serious diseases. And so you asked me, is the drug preclusion clause being implemented effectively? The answer is yes, but I do have some concerns, and let me explain what my concerns are. And I think maybe they'll provide a basis for a good discussion here today in this webinar. FDA in recent years determined that a specific ingredient, nicotinamide mononucleotide, or NMN, was excluded from the definition of dietary supplement. FDA came to that conclusion because FDA said, no, it's being investigated as a drug and therefore can't be marketed as a dietary supplement. The Natural Products Association, or NPA, filed a citizen petition with FDA challenging FDA's interpretation of the drug preclusion clause. And then they filed suit against FDA. This all happened last year. And in the context of that litigation, FDA said, okay, stay the litigation. We promise to answer the citizen petition by July 31st, 2025. So that's late next week. We expect FDA will answer this citizen petition that's challenging the way the agency currently is interpreting the drug preclusion clause. So I think FDA is interpreting it correctly, but I'm concerned about what might happen next week, depending on how FDA comes out in responding to this citizen petition. One other point here, last fall, kind of around the time the litigation was stayed, the White House's Office of Information and Regulatory Affairs, OIRA, published in the semi-annual Unified Agenda of regulatory and deregulatory actions that federal agencies intend to take, that FDA was intended to take and initiate a rulemaking to provide that an ingredient is not excluded from the dietary supplement definition. So this is that one exception to the drug preclusion clause. Two exceptions: if it was marketed before it was investigated as a drug, you can continue to be marketed as a dietary supplement. Second exception, FDA by regulation can do that. FDA's never done that before. And here we have notice from OIRA that FDA intends to do that. Now, that notice, say it was about NMN, it might have been about another ingredient, N-acetylcysteine, or NAC, that we can talk about. Much different situation than NMN. But that's why I'm concerned about the continued sort of application of the drug preclusion clause.
That's helpful. And Kyle, let me shift to Scott here for a minute, since I want to pick up where I left off in the intro remarks, where you truly were in the room when DSHEA was drafted. Talk a little about what Kyle said about the drug preclusion section or the clause, and is it accomplishing its main purpose as you originally when you were drafting this? And what say you what Kyle said about what's happening at the FDA?
First of all, I agree with everything Kyle said. That's number one. Number two, the purpose of this law is very simple. It was not in the first few drafts, either House, the Richardson bill, it was nothing like this, and the first Senate bills. It was actually Bill Schultz, who of course worked on Hatch-Waxman in 1984, who introduced this section, actually wrote the first draft. We didn't, on industry and Hatch side, because he wanted to preserve Hatch-Waxman and the drug definition. So the whole purpose was that. Then came in, and those who are asking for foreign data better watch out what they ask for, because one of the concerns at the last drafting session, Bill said, well, you can't take a drug from overseas and sell it as a supplement. I said, yes, you can, as long as it doesn't have claims and it meets the safety standards. So that's the other thing that went into here. So those who want foreign data and use a supplement, I would caution you not to ask so strongly. Number two, I think in answer to what I think has been said very articulately and correctly, is FDA is following the original legislative intent, but it is one of only two places or three places where I think the statute needs to be changed. There are 4 or 5 things wrong with the way we drafted this, the way we negotiated back. There were a bunch of us who were involved, not only Tricia Knight and Lauren Israelson and Peter Reineke, but others as well, who, in retrospect, we could have done a much better job. So there are 5 things that need to be fixed, which I can go into later. But essentially, what Kyle said, it's being applied by FDA in a fair way, but it's very unclear what the whole thing means.
Steve, you're nodding your head. I'd like to hear
No,
your thoughts.
I'm shaking my head because I'm going to disagree with both of these
Okay.
gentlemen on a number of counts.
For a
Okay.
change.
Yes. And I think we very quickly have gotten into the weeds and we need to kind of step back a little bit. So, my first point is this provision is not just about one ingredient. It's not just about NMN. And we have seen it apply to a number of ingredients. NAC is the one that is most recent. But this was also the reason why, for instance, CBD was originally kept out of the market. It was not initially a safety conversation. FDA invoked drug preclusion as a way to keep CBD out of the market. And we have seen in various warning letters over time that they have threatened to use it against other ingredients. So that's the first thing. The second thing is, I think it's a lot of this really, it's important on how we visualize this, and it does come down to semantics. I don't want it to look like that the drug preclusion is an exception, or it's sort of a carve out, or something that only gets used in rare instances. The definition of a dietary supplement in DSHEA was attempting to create a line between what is a drug and what is a supplement. It wasn't that they created a little narrow exception. It was setting a line between these two categories. And what the law says is that if the product is already in the supplement marketplace prior to it becoming a drug, then it can be a supplement. If the drug companies get to the ingredient first and they do significant clinical trials that are made public, or they go ahead and they bring it to market, then they get essentially a monopoly over that article, and it's perpetual. So that once it's declared to be a drug first, supplement companies never get an opportunity then to use that article. The reverse is not true, though. Even if we get there first, if a pharmaceutical company wants to later study the ingredient for a drug purpose to treat, cure, mitigate, prevent a disease, they can still use it in that capacity. So it is not an equal playing field in the first place. But it does serve an important purpose. And I think this goes back to what Scott was talking about. Back in the in the smoke-filled rooms of 1994, there was concerns that companies would take a pharmaceutical ingredient and then try to put a structure function claim on it and bring it to market as a supplement. So the drug preclusion has a valid purpose, and we're certainly not trying to undermine that. If drug companies get there first, then they should have the ingredient. But in cases when you think about things like omega-3 fatty acids or niacin or even vitamin D, which can be sold as a prescription drug, the supplement industry had those ingredients first, and because of the way the drug preclusion dividing line works, we're able to keep selling those things because we got there first.
I feel
Can
like
I just disagree with one major thing? There was no
Go ahead,
smoke in
Scott.
the room. There was no smoke in the room, Steve, because only Bill Richardson smoked and he wasn't part of the last negotiation.
I was not going to disagree with Steve at all. I was going to say I think we're in violent agreement.
Right. I didn't see any contention there, but I did want to say, as we talk about the drug preclusion clause, what kind of amendments? Because Scott, you touched upon it. Are there amendments that are needed to
Yes.
to better balance this innovation in both the pharmaceutical and the dietary supplement industries? And if
Yes, there
so,
are
give us
five.
some ideas. Oh, all right, go
There
ahead,
are
Scott.
five. And one thing
All
that's
right.
clarified for everybody listening, it's not automatic that a supplement goes first and stays on the market. You must remember we wrote in a safety issue. So if it turns out later that something sold as a supplement became a drug and there are safety concerns, the supplement can still be taken off the market. Anyway, let's get back to this. There are five things that need to be changed. First, the word article, inadvertently, no one focused on the confusion that has caused. Number two, abandon. The biggest issue to me is abandon, and Steve picked up on this, INDs, BLAs, and NDAs. If a drug company starts a substantial IND and doesn't bring it to approval, or they get a drug approved and they take it off the market, there's no reason the supplement shouldn't be allowed on the market. And that's not in the statute, but it should be. Number three, the dosage delivery form. A lot of discussion about that. It's kind of a yawn to me, but definitely should be clarified because amount of controversy. Number 4 is overseas sales. As I said, those who are advocating if it's sold as something overseas, watch out what you ask for because I can turn that around and bite the industry very badly with that. So I would stay away from that. And finally, the date is a date of publication of the IND or is it date of filing? To me, it's easy. We intended date of publication when it became public. One of the major amendments we put into Bill's draft, there were 2. One was publicly available and the other was substantial. So clearly our intent there, which I think is very clear, is date of publication.
Kyle, anything you want to add to that?
No, I think it's a fair suggestion that amendments to the drug preclusion clause to add clarity would be appropriate. I mean, the issue is that the Food and Drug Administration is not permitted to disclose the existence of an IND. That's to protect pharmaceutical manufacturers and their confidential commercial information. That said, there is, a requirement under the act that clinical studies, essentially all clinical studies for these purposes, be published on clinicaltrials.gov 21 days after the enrollment of the first human subject in the trial. And so there is a window there where a dietary supplement manufacturer would not know, who got there first. They would not know until the publication on clinicaltrials.gov that this is going to be a precluded ingredient. And so,
well, actually, Kyle, that you make an excellent point, but the reason we did it, that was long before FDAMA put in clinicaltrials.gov.
Yeah.
The reason we did it was we said to drug companies, you can't take advantage of preclusion unless you've made it public. That was the intent.
Yeah, and
Yeah.
I'd like to jump in on this too, because I think
Please.
this is one of the areas where I think FDA is misreading the statute. There are other areas that are open to debate, but when you think about principles of fairness and notice, I mean, you can't have a statute that gives the pharmaceutical side of the industry a monopoly, a perpetual monopoly over an article, and not allow the supplement side of the industry to have notice that this ingredient has now been plucked out of the potential marketplace. Otherwise, what you have is a pharmaceutical company can file the IND and then continue to work in secret. A supplement company, not knowing that the IND has been filed, brings the product to market, spends lots of money on marketing and additional research for its structure function purposes, and then finds out down the road that the carpet's been pulled out from under them and that this drug was precluded.
Steve,
So
you're absolutely right. You are absolutely right. And that was the intent. And by the way, at a full disclosure, while I'm speaking my own opinions here, I am CHPA's Dietary Supplement Council, so I do have interest in both camps. But predominantly, the main point remains yours, Steve. It's all fairness. And that was the intent. There's no question. The intent was, unless they make it fully public, they can't take advantage.
Yeah, so I think that's one area where, I think FDA is misinterpreting the statute. They're trying to torture the language in order to get that reading of it. But any fairness, equitable conversation around the law says you have to give notice to the other parties. And then as Scott points out, where there are dramatic differences in strength or dosage of a product or even dosage form, when you think about N-acetylcysteine, the research that they cite for precluding N-acetylcysteine in the supplement market was an inhaled drug. And of course, if you're inhaling it, it couldn't be a supplement. It has to be ingested. So the dosage form is different. The amount, the strength of the dosage is different. The nature of the claim is completely different than what it was being used for. So those are the kinds of things that I think FDA has to weigh when they're making that drug preclusion decision. It may be that it's not the same article for all purposes. And then Scott also points out the abandonment issue, which is important too. If drug companies start down a road and then decide it does not work for epileptic seizures, and then the industry comes along, the supplement side of the industry comes along and says, hey, you know what? This might help people sleep a little better. Should their clinical research on epileptic seizures be able to prevent the supplement side of the industry from bringing that same article to market as a sleep aid?
Let's talk a little about how this dynamic of the drug versus dietary supplements. I'm going to go to you, Kyle, for a minute. How can the FDA ensure clarity and fairness in determining when a substance has been first authorized for investigation as a drug versus when it's marketed as a dietary supplement?
Well, this goes to the point Steve was just making, that another way to state that question is how can the law be amended to, or just understood, even interpreted by the agency, to give fair notice to the dietary supplement manufacturer that the ingredient is precluded because it's been authorized for study. And uh, I think the answer is that will come. I think there are opportunities there to have a negotiation and talk about things. I mean, I represent a lot of drug manufacturers who would not want the statute or the FDA regulations to be changed with respect to making their INDs public at the moment they're filed. But maybe there's an opportunity to do that after they're cleared, or at some point that would provide that fair notice to the dietary supplement manufacturer. The flip side of that is, you know, could the agency provide guidance or some amendment to the statute on what constitutes bona fide evidence of lawful marketing as a dietary supplement, in order to get those two signposts? When was it authorized for investigation as a drug, and when was it marketed as a dietary supplement? That's kind of the factual dispute in all of these cases, and some clarity on both those points could be helpful.
Kyle, one of the things we thought about was quarterly reports, SEC filings, where the drug company chose to say, hey, we have the Steve Mister study underway. We're hoping that this Kyle substance becomes approved, and that is the notice. So we very definitely debated that a lot, and the very clear intent is until it's publicly available in truest sense, you can't rely on that date.
I don't want to speak for Steve, but I think the concern is that delta, right, where you, as a dietary supplement manufacturer, you're doing some work that then gets jerked out from under you.
Yeah.
So it's narrowing that time between study as a drug and becoming publicly known that it studies a drug.
Yeah, and I don't think we're suggesting that we're going to change the IND process to prevent people from being able to do that, with a certain degree of confidentiality. But I think drug companies should know that filing the IND, if they're doing it and they're not publishing any of the scientific investigations, that alone will not give them the exclusivity that they want. That in order to have drug preclusion kick in, they have to make something public so that industry is now put on notice that this ingredient is now in the pharmaceutical realm.
Yeah, and see, it just has to be the fact of the IND, not the actual clinical study parameters.
Steve, I want to go to you on a different issue. Just, we have gone deep, and I want to zoom out a tad. And just as we look back over the years, 30 years, DSHEA has been the law of the land. As you look back, what aspects of DSHEA do you think were misjudged or overlooked?
Well, I think there is this misconception now that we can't touch DSHEA, that, somehow when it was passed in 1994, it was frozen in time. And so now we can't amend it. And that overlooks the facts that it has evolved over the years. I mean, there have been several amendments to DSHEA over time. I mean, the adverse event reporting requirements were added in 2006. In 2011, FSMA was enacted, which also then required facility registration for dietary supplement manufacturers as well. So, we have seen DSHEA kind of evolve over time. And I think, as we look now, we realize that there are probably some other things that need to be tinkered with just to keep the statute, up to date. I mean, when you think about it, it was passed in 1994. The internet was just barely taking off at that point. I don't think we had any idea that, the volume of supplements that would be sold online that are today, as well as the availability of information that DSHEA provides, or that the internet provides, And so DSHEA has to accommodate that to make sure that consumers can get good information because we just didn't think about it. I mean, to really drive the point home, the provision in DSHEA that talks about clinical studies is still envisioning a reading room at your local vitamin store where you would go to the store and then sit over in a lounge area and read the scientific studies in paper and then walk over and buy the product. And we certainly know today that people do that online. So how do we make DSHEA, how do we bring it up to date to reflect that reality?
Scott, anything you want to add there?
Yeah, I think there are 5 things when people ask me, and again, I'm speaking my personal opinion, not on behalf of CHIPA, although it's consistent. First, we have to change 301V, which was passed to 301U. That is the enforcement of Section 413, new dietary ingredients. FDA's made a million excuses about not enforcing against companies that don't file NDIs, and none of them is valid because I think this language is fine, but we have to clean that up so FDA doesn't hide behind that. Number 2, what you're talking about here, right? The drug preclusion. Number 3, the NDI process is a mess. There are these phony loopholes that people have invented on so-called self-grass, where you put it in a candy bar and feed it to your employees and say it's generally recognized. So some huge percentage, like 90-something% of new ingredients aren't going through the notification process. And third, in addition to this, the one that bugs me the most is the blatant misinterpretation on purpose of 201FF1E, which is the innovative provision of DSHEA. We called it the CoQ10 provision at the time, which is if it's not a vitamin, not a mineral, not an herb, but it's something else we take to supplement our diet and want to leave that open. What is it? Congress, somebody, Waxman's office, had put in the word nutritional. Congress took out the word nutritional, and yet 10 years later, FDA's chief counsel's office says it has to be nutritional. So they're really killing innovation. And finally, third-party literature that Steve just mentioned.
Alan, anything you'd add there? Or Steve, it looks like you wanted to say something.
Well, yes, Scott, you failed to mention a mandatory registry so that FDA actually knows what's in the marketplace. I mean, it seems like to me that should be on that list too.
Well, since I came up with that horrible idea that everyone hated, Steve, I will just say that I think they can do it regulatorily and they don't need a statutory section for that. But I'll go with you if I know there was a bill with it, so I'll just follow all you guys.
Yeah, I think that's one of the problems with trying to have DSHEA evolve is we need FDA to be more willing to evolve their thinking around DSHEA. As Scott says, the FDA might be able to do a mandatory registry short of legislation, but if they refuse to do it, then that leaves the industry no alternative but to go to Congress. I think the same is true with drug preclusion. Kyle mentioned that this answer to the citizens' petitions is supposed to come out maybe as soon as next week. And CRN has a citizens petition in as well. Ours is broad around the entire drug preclusion issue. It's not specific to any one ingredient. And that's another area where we think FDA could answer these questions around drug preclusion by evolving their thinking. But if they won't, then they leave the industry, another option, which is to go to Congress and actually change the language of the statute.
Well, and that's the perfect transition. I want to return to Kyle on this issue. Let's go back to where you'd begun, and let's talk about next week. Why should the average American, especially those who are taking dietary supplements, care what's going to happen if it looks like some decision will be made next week? Why should we all care? And really, what is at risk here if they get it wrong?
Well, let me give you the headline first. The concern is that the incentives for pharmaceutical companies to invest in innovation will be reduced if the wrong result happens next week. That's my headline. Let me back into that a little bit. So if in fact the agency answers the citizen petition and says, you know what, we are going to issue a regulation under our authority, under that drug preclusion exception, and we are going to say that NAC or NMN is appropriate for marketing as a dietary supplement. I think there's some concerns there, but they're very distinct. So I think if the agency does that with regard to NAC, it could tailor the response in a way that addresses the abandonment issue that Scott mentioned, that effectively says, This regulation is a one-off regulation. It only applies to this ingredient. But because the drug manufacturer who invested in investigating this NAC ingredient as a drug has abandoned that effort, and it's not being investigated as a drug ingredient. Therefore, the drug preclusion clause does not apply, and it can be marketed as a dietary supplement. I think that would be fine. I think it would be better with a legislative fix than a one-off regulation, but I think that would be fine. If the agency, though, is focused on a regulation related to NMN, I think that's problematic because I don't really know what standards FDA would use in saying this ingredient that's been authorized for investigation as a drug, as a new drug, and that for which substantial clinical investigations have been initiated, and that's publicly known. All of those things, apply here, but nevertheless, as an agency, for whatever reason, because we're getting pressure, I don't know why, but we're going to issue a regulation and say that this ingredient can be marketed as dietary supplement. I think that would be problematic, and it would be something that everyone should be concerned about because it would really undermine FDA's drug approval process. It would significantly impact the incentive firms have to make substantial investments in drug research and innovation. Why would I spend the money to investigate this ingredient because, as a potential new drug, if a dietary supplement company can just come and start marketing it and totally undermine my market and my investment?
Scott, on that same note, do you think FDA is bending the law against dietary supplements?
I mean, certainly, yes, on innovative products. And
Right.
I have, for 20 years now, questioned why they need to do that because FF1E is so clear and legislative history
Right.
is right in front of you. But on this provision, no, I think it's confusing for the reasons we've said. On the other hand, echoing what Steve and Kyle mentioned, another example, Steve, I think, of a totally wrong interpretation is resveratrol. Very easy. It was started as a supplement, then it became a drug, and then that was abandoned. And the analysis under FF3 is kind of tortured. So I don't think it's purposeful. I just think that, as Kyle said at the beginning, I don't think FDA is intentionally doing anything here, but it's very tough. All these different ingredients with an imperfectly drafted statute make it quite difficult. We just want the right result.
The other part of this that we haven't gotten into is so you have the initial decision whether a particular article is drug precluded or not. And there needs to be some really clear criteria that we've been talking about on how the agency makes that decision. But then at the end of the clause, it then goes back and says that the secretary can grant an exemption, even if it is completely drug precluded by whatever factors FDA has decided on. The secretary, meaning FDA, could still by notice and comment rulemaking create an exception. And that is what we've been promised in the case of NAC, N-acetylcysteine. So even without a change in their thinking on the criteria for drug preclusion, FDA could go down that road. In fact, they went through a notice and comment period to submit safety data for NAC. They seem to be pretty satisfied that the data around N-acetylcysteine shows that it is a safe ingredient. So the last part of this question then is, okay, when FDA exhausts all those other possibilities and then decides that for whatever reason that they should allow it into the supplement marketplace, what's the criteria they're going to use to determine that it's, I think the word is otherwise lawful? How are they going to make those decisions, as would be the case in N-acetylcysteine, which seems to be where they're headed?
Exactly. How are they going to come to that determination? There are really no standards.
Yeah. And I go back to what I said earlier, which is, the supplement industry is not trying to take away all pharmaceutical innovation. Pharma companies should be allowed to innovate, spend lots of money to do that, and then get a reward for doing it. But there needs to be some balance to allow the supplement side of the marketplace to do the same kind of thing. Because as we look at what's going on in the supplement space, so much more of the attention around healthcare is around wellness and prevention and doing things to stay healthy in the first place, which is where the supplement side of the industry really excels. So that innovation needs to be protected, as well as the pharmaceutical side that's trying to treat, cure, mitigate a disease.
Kyle, Scott, anything else on that point?
No, except to echo earlier comments, when we drafted this, we were talking about $4 billion. If you told me that within the next few years, the international market is going to be $200 billion, which is the prediction, I would have said we're dealing with a different paradigm. Right then, we're just a slice in a new category among the established ones that Kyle mentioned. But it really changes dynamic. And I think what Steve just said is very, very important. You have to create incentives for very good research and very good supplements in the idea that preventive health now is the new paradigm.
And really, we have DSHEA to thank for a lot of this. I mean, it went from being a $4 billion industry to now being well over $60 billion. Think about who took a dietary supplement in 1990. And today, 3 out of 4 Americans are using at least one supplement and often many supplements. I mean, the industry really has come of age because of the balance that DSHEA allowed, and the creation that it created market incentives for people to come to market, and it gave consumers access to get information so they could understand what these products actually do for them.
And on that point, I want to ask all of you, what do you think is the greatest threat to the dietary supplement industry? What is it? Is it this issue that we've been talking about, or are there other issues that are a part of it?
Well, I will give you a very unpopular opinion.
Okay.
I think the greatest threat to the dietary supplement industry is the dietary supplement industry. Steve just said it's come of age, which is correct. But unless companies file NDIs and go along with his suggestion of a master list registration, I think all it takes is another L-tryptophan episode to really hurt it. So that would be my number one concern.
I agree with Scott. I mean, I think the risk is kind of nefarious folks who are marketing products that don't have a reasonable expectation of safety. They've not submitted NDI notifications, and are able to market products that present safety concerns as dietary supplements. That can tarnish the dietary supplement industry.
And I will take a slightly different take on where the threat comes from. I agree with Scott and Kyle that we've got a problem with, bottom feeder companies, but I think the threat comes from the fact that we don't have effective oversight and enforcement of the existing law. I run the trade association in the dietary supplement space. You cannot expect responsible companies to be the police. For one thing, we don't have guns and badges. We don't have the ability to bring criminal sanctions against our competitors. And you look at so many areas where we have problems in the industry, products that are not what they are labeled to be, products that make unrealistic claims for disease treatment that they cannot possibly achieve. Those are things that are blatantly illegal under DSHEA and the Food, Drug, Cosmetic Act today. And so we need an agency that is willing to protect the responsible players by going after the bad guys, and making examples of a few of them so that it sends a real deterrent message to everyone else that FDA is actually on the beat. And that is actually what is really concerning me today, that we're in kind of a deregulatory atmosphere more generally anyway. And FDA has always been under-resourced when it came to dietary supplements. CRN worked very hard for a number of years to keep increasing the budget to that part of the agency. But that is what I think is our biggest threat, is that if we have an agency that doesn't implement the existing law, responsible players can only do so much to self-police themselves.
And I would just add my view that the pharmaceutical industry is not a threat to the dietary supplement industry. Pharma companies are not looking around saying, how can we box out dietary supplement companies from looking at these new ingredients? They They invest where they think there's an opportunity for a drug to be developed that they can establish as being safe and effective for the treatment or prevention or diagnosis or cure of a disease. And so from my perspective, it's not big pharma that's the threat to the dietary supplement industry.
Can I add something there, Matt?
Of course.
And I 100% agree with Kyle. People said to me at the time, and even to this day, isn't it the pharma industry that tried to put this in? It wasn't the pharma industry fighting against DSHEA. And it's good to remind people the answer is zero. Pharma never opposed anything in DSHEA, wasn't at the table, and isn't opposing it. To Kyle's point, the world of pharmaceuticals and supplements is merging globally into the self-care industry. So we can even reshape the 1938 definitions from our act, which had 5 or 6 categories, into a new one, which is self-care. Self-care includes OTC drugs, dietary supplements, traditional medicine, and other and certain medical devices that are not by prescription, and there's still a critical need for prescription products and restricted devices as well, as Kyle had mentioned. So I think if we broaden the definition, Matt, and look at this from a broader perspective, we're in a new, what someone called recently, healthcare 4.0. And so that would be my sense of agreement with both of them.
I would agree with Scott, but only to a point, because even
Good.
even though we have this umbrella term that's very nice for marketing to talk about self-care, that umbrella is actually composed of lots of different regulatory categories. I mean, there are cosmetics that are part of self-care. There are devices that are part of self-care. There's even food that's part of self-care. And they still have very separate regulatory categories within the Food, Drug, and Cosmetic Act. So
Why
unless
can't we change that, Steve?
well, I was
I'm
getting ready to
serious.
say,
That's my point.
unless we're prepared to really sit down and upend uh, the Food, Drug, and Cosmetic Act, which I have not seen any appetite for in Washington, I think we have to live with the regulatory categories that we have, and we have to
Well,
accept that they are going to bump up against each other from time to time. So we have to find ways to draw equitable lines between them, whether it's between supplements and drugs, whether it's between cosmetics and drugs, whether it's between food and drugs. All of these things are going to bump up against one another, and in the short term, we have to find ways to draw fair lines between them.
yeah, maybe, but I think Commissioner Kennedy would be open to rethinking this and working with Congress, and I take that as a challenge.
Let me just ask this: Steve, you keep on opening these wonderful transitions. Thinking back from 1994 to current day in 2025, you all have your insights of how the relationship has changed with Congress back in 1994 to present day. How has the reception of the dietary supplement industry been received now? How's it changed?
Well, I can tell you, because we do an awful lot of outreach to Congress. We have what we call our freshman orientation every 2 years, where we go and get in every office of a new member. Uh, I am always surprised how many members of Congress are using dietary supplements today. I mean, it's quite shocking. I think it's more than the 75% of the American population. So on the one hand, Congress is very familiar with these products. They are seeing benefit because they're using them themselves. I think the difference, though, is, and this is obvious, we don't have the kind of super champions that we had in Orrin Hatch and Senator Harkin today, where they really would, lay themselves down on the road to protect the industry. And we're trying to cultivate kind of champions like that, but we don't have those people today.
Let's do this. This is how I like to end all of our webinars. And it's this: we're going to do a lightning round. You get one. This is the question I want you to answer, and it's going to be short and sweet. But what keeps you up at night with the dietary supplement industry and what we've talked about? I'd like to hear, and we'll start with Scott, then move to Steve, and end with Kyle.
The NDI mess.
Okay, that it, Scott? All right. For me, it's states who are now trying to get into the business of creating their own regulation for supplements. We need some preemption around this so that we have one federal set of requirements and nothing else.
For me, I'll end where I began. I mean, to me, it's the near-term issue that could happen as soon as next week with FDA issuing a regulation that either, that in the worst case scenario would allow a pharmaceutical ingredient, that is an ingredient that's currently being investigated as a drug, to be marketed as a dietary supplement. That's what keeps me up at night, because I think that would be the agency, kind of blessing the violation of law, essentially the marketing of an unapproved drug. The agency taking action that would jeopardize consumer safety, because the clinical investigations being conducted have not determined safety and effectiveness, and there's no NDI notification. I'm speaking about NMN, but this would apply to sort of any pharmaceutical ingredient. It would reward illegal activity, and importantly, it would disrupt the incentives for new drug R&D, which I think could have significant long-term, perhaps unintended consequences. If the agency is feeling like it needs to do this because of some desire or maybe a political perspective of let's allow more products to get to market faster and easier, I think there's significant unintended consequences that could come out of that, in that it would really negatively impact the incentives drug companies have to innovate.
Thanks, Kyle. We'll end on that. With that, we'll bring our webinar to a close. Kyle, Steve, Scott, thank you for your perspectives, your insights on how we can ensure continued safety and innovation when it comes to dietary supplements. As many of you know, the Hatch Foundation's mission is to advance common sense solutions, and today's discussion has helped us move us closer to that goal. To our audience, we hope you've enjoyed today's webinar and will join us for future events. Thank you for joining us.